come.
Beetlejuice.
It's showtime.
Howdy, howdy, howdy. Did you miss me, miss me, miss me? Let's do this Joe Biden thing. I rewound it a little bit here. He's going to be on here in a second. This will be fun. Let's go, Brandon. Gotta love it when I don't close my studio door here. So now we are ready. We are locked up. We are locked in. We are waiting on Brandon to come out. He will be here shortly, supposedly. Oh, here he is. Here he is. There is the studio they built for him. Now think about this. There's a studio. Imagine anybody else in the history of presidencies.
Hi, sir. How are you?
Having studios
Well,
built for them. This is fake. We don't know where this is. They won't tell us that one either.
Apart, while we're speaking, we're going to take our masks off. And let me begin by saying good afternoon to my team. Good afternoon to the press.
Now, people have gotten into about this window back here.
I'm about
Look
to
at the
receive
snow.
a briefing from our COVID-19 team. But before I begin, I know there's a concern and some considerable confusion about the rising cases. So let me provide a quick update.
Oh, good,
Dr.
Dr. Brandon.
Specific topics. And I'll give it to you straight, as I promised you I always would. We're going to see, as you all have been hearing, continued
Everything I say is a comedy.
Cases.
Don't take this serious.
Omicron is very transmissible.
Joe Biden is a fine, upstanding young man.
Much different than anything we've seen before.
So glad to have him leading our country.
And you should protect yourself, quite
I think
frankly.
everybody know
Get
YouTube.
vaccinated.
All my listeners
Get
know this is a
boosted.
joke.
Plenty of booster shots. Wear a mask.
Everything I do
while
is
you're in
this is
public.
comedy. This is a
Because what we
routine.
know is this.
Everybody knows
The
we all love
impact
Brandon.
from the rising cases depends on the effect on the person based on whether that person, what their vaccination status is. You can control how big an impact Omicron is going to have on your health if you get over Omicron. You know, those are fully vaccinated, especially those with booster shots. And by the way, we have booster shots for the whole nation. Okay,
We've got to talk about monoclonal,
but
though.
it's highly unlikely, very unlikely that you become
just gotten
seriously
over
ill.
Corona.
And we're seeing COVID-19 cases among the vaccinated and workplaces
monoclonal
across
is
America,
amazing,
including here at the White House. But if you're vaccinated and boosted, you are highly protected. You know, be concerned about
the 300,000 people in the United States that rely on sign language.
But if you're unvaccinated,
we
you
have
some reason
closed captioning.
Many of you will,
she's making $85,000 a year.
Cases if you get COVID-19, if you're not vaccinated. Some will die, needlessly die. Unvaccinated are taking up hospital beds and crowding emergency rooms and intensive care units. That's displacing other people who need access to those hospitals. So
hospitals
please,
are there to make money.
Please.
And they need people in those beds.
Now. You know, we've reduced the number of American adults without any shots from
it's not displacing anybody, is what I'm trying to say.
About 35 million
not serious.
In the past 6 months. But there's still 30.
Hospitals are built to handle certain things.
Not vaccinated. And let me be absolutely clear. We have in hand all the vaccines we need to get every American fully vaccinated, including the booster shot. So there's no excuse. No excuse for anyone being unvaccinated. This continues to be a pandemic of the unvaccinated. So we got to make more progress. And for patients who still haven't gotten your kids vaccinated, please get them vaccinated. Look out for their interest here. It's the best way to protect them. And for parents with kids too young to be vaccinated, surround your kids with people who are vaccinated.
That's weird.
Make sure you're masking in public.
That's
so you don't
weird.
Get COVID and give it to your kids.
So don't be around people who you are just telling people
at this point that Omicron is worse for children than previous variants. We know that our kids can be safe when in school, by the way. That's why I believe schools should remain open. You know, they have what they need Because of the American Rescue Plan, with the first month we were in office, or second month, that I signed in March, we provided the states with $130 billion, with a B, billion dollars to specifically keep our students safe and schools open. Funding for ventilation systems in the schools, social distancing in classrooms, even larger classrooms, on buses and everything from bus drivers to buses, the actual bus. There are additional, in all this process, we also back then included an additional $10 billion for testing for schools. That money
You
went
get that
out to
right.
the
The
states.
American Rescue Plan was done in
And
March.
the states and the school districts have spent this money well, many of them, but unfortunately, some haven't. So I encourage the states and school districts to use the funding that you still have to protect your children and keep the schools open. Countries across the world are seeing rising cases. Here in the United States, our team has been working around the clock during the holiday weeks. In the last 2 weeks, we have developed hundreds of military, we have deployed, I should say, hundreds of military doctors and nurses to staff the hospitals in our states that are overrun and overworked because of unvaccinated COVID-19 patients primarily. The Federal Emergency Management Association Agency, FEMA, is also working at our direction in every state on hospital capacity, including whether they need beds. I've directed FEMA to be ready to provide emergency hospital beds wherever and whenever they're needed. The federal government will be there. We've shipped nearly
Federal government will be
2.4
there.
million pieces of protective equipment to hospitals, from gowns to gloves. And we're doing whatever we can to protect communities from the surge of hospital cases that are likely to see from the unvaccinated population. Look, now let me address 3 specific updates before I get my full brief from my team.
Is that Kamala
First,
Harris?
booster shots. I know, Dr. Fauci, I'm like an echo chamber here, okay? I know it.
Remember when
But
Fauci was
repeating
thought
myself,
that
but Dr.
Trump is
Fauci
the greatest
said
he's ever seen?
very clearly,
Did everything he could.
booster shots work. They significantly increase the protection. They provide the highest level of protection against Omicron. Americans, we've given out over 70 million booster shots. Importantly, 2 out of 3 eligible seniors have received their booster shots. Booster shots are free, they're safe, and available. Over 90,000 vaccination sites. Let me say that again. They're free, available, and at over 90,000 sites. We have added sites, added hours, added appointments, added walk-in capacity. We have booster shots for every American in the country. It's easier
What about
than ever to get a
monoclonal
booster
shots?
shot. More importantly than ever has been. Look, the FDA has also now authorized booster shots for children ages 12 to 15. So, with the final approval from the Center for Disease Control and Prevention, the CDC, young people, when that occurs, young people ages 12 to 15 will be able to get booster shots later this week. Second, on testing. I know this remains frustrating.
Why do young
Believe
people
me, it's
need booster
frustrating to
shots?
me. But we're making improvements. In the last 2 weeks, we've stood up federal testing sites all over the country. We're adding more each and every day. Google, quote, COVID test near me. Go there, COVID test near me on Google to find the nearest site
Well, that was
where you can get a
what about
test
Bing? I use Bing.
most often and free. Look, with
I'm not
more
using
capacity
Google, I
for
use
in-person
Bing.
tests, we should see waiting lines shortened and more appointments freed up. Look, if you want to test yourself at home, we have 3 options now. 1, drugstores and online websites are restocking. 2,
I can only get tested.
so the more tests are available, we're going to continue to become available. Next week,
It was impossible. for me.
our
5
requirement that your
hours to get
insurance
tested.
company reimburse you for at-home test takes effect, so you don't have to get reimbursed. So if you're insured,
Somebody has to
you
pay
can
for
buy
that.
the test and get paid for it. The second thing I want to mention is many states and local governments and healthcare providers are passing out free at-home tests that you can pick up. Just find out where they are. And finally, as I announced recently, the federal government is launching a website this month where you can get tests shipped to your home for free upon your
Nothing
request.
is free. Why does it
The
keep
third
saying
point I'd like
free?
to speak about is also
How's it
is
free and
on
nothing else in the world
treatments.
is?
For those at high risk who do get COVID-19, we now have a new Pfizer pill that greatly reduces the risk of hospitalization and death. I'm pleased to say
I was gonna say,
On
why isn't that
Christmas
chick doing her
Eve,
job over there?
we
Sign
shipped out
language.
the first batch of these pills that we purchased and received. And more will be shipped this week. They're already saving lives, but due to complex chemistry of the pills to make the pill, it takes months literally to make a pill. But production is in full swing. The United States has more pills than any other country in the world, and our supply is going to ramp up over the coming months as more of these pills are manufactured.
What pills are you
Today,
talking about? I missed
I'm
that part.
directing my team to work with Pfizer to double our
Pfizer.
order from 10 million to 20 million treatment courses to be delivered in the months ahead. We may need even more. That's the estimate we need right now. We've already placed the largest order in the world. Now I'm doubling that order. These pills are going to dramatically decrease
You can't say we've already placed the
and
largest
death from
order in the
COVID-19.
world and act like that's something big. There's only
We're
two
a
countries
game
that have
changer.
a bigger population
That
we
have the
do, China
potential
and
to
India.
dramatically alter the impact of COVID-19, the impact it's had on this country and our people. Look, let me conclude with a quick recap. If you are vaccinated and boosted, you may get COVID, but you are highly
not vaccinated.
protected against severe illness. Schools can and should be open this winter. We have all the tools
That
to
is
keep
not
kids
what happened to
safe.
me.
Unvaccinated
Again,
kids
don't listen to
are at
me. I'm
risk.
not giving any medical advice. If
Yet
you think I'm giving
the
medical advice,
vaccinated
whoever's listening to this and editing
are
this, you're
gonna
an
worst
idiot.
way to
I'm not
protect
giving
them.
any
Get
medical advice.
vaccinated. If you're vaccinated, get boosted. Folks,
Yeah, go do
I
all
know
this
we're
stuff.
all tired and frustrated about the pandemic. These coming weeks are going to be challenging. Please wear your mask in public to protect yourself and others. We're going to get through this. We're going to get through it together. We have the tools to protect people from severe illness due to Omicron if people choose to use the tools.
Last week or 2 weeks ago, you
You have the
couldn't
medicines
tell
coming along that
if
can
the variant
save
you
so
had
many
was
lives and
Omicron or not.
dramatically reduce the impact that COVID has had on our country.
That is what my
There's
piece
a
of
lot of
paper
reason to
said.
be hopeful in 2020. But for God's sake, please take advantage of what's available. Please. You're going to save lives, maybe yours, maybe your child's. Please take advantage of what we already have, okay? So thank you. Now I'm going to get this briefing started. Thank you very much.
I want to know about this room. Okay, first of all, don't pay attention to me. All I am is a loudmouth. Look, what are they doing here? I want to know where he is. I want to know where that room is. And now what briefing is going on? Why does everybody have to leave for the briefing? That's what's weird. Brandon did a good job talking, but he's selling the same thing. It's now become, it's like they're dependent upon that. If people stop believing what he was saying, I'm saying this from a political point of view, not anything medically, okay? But politically point of view, they would have no message whatsoever. There is no other message besides get vaccinated. It's the exact same message, though, that I don't even know if you can say his name on some of these platforms. The last guy, the orange man, he said, get vaccinated and everything. Just this week, Fauci said he was so proud of the last guy for telling people they need to go out and get the vaccine. And that's great. I'm just on the political side of things, though. These people have nothing to say if it's not about this. And it's now become a comedy when you look at things from political optics. You look at this and you just say the opposite. Just absolutely say the opposite. All of our politics is somebody says something and you just say the opposite of it. And you're a football team. You're trying to get more people to like your football team than like the other team. And matter of fact, I'm surprised that like Democrats and like Republicans haven't done polls to see what are people's favorite colors and then adopted those colors. I expect that to happen now that I've said that. You'll see Republicans will probably have a bigger backlash if people stop using red, white, and blue, but you'll see things like neon yellow being used. You know, there'll be like colors. What are the most prominent colors, you know, that people notice? Anyway, still, it's all a, I don't know. It's just the politics of it sickens me. I'm not here to talk about anything medically. If you want to talk something medically, I am recovering, whatever it's called, from the coronavirus. And I'm telling you, the monoclonal that they gave me is the most amazing thing I've ever experienced in my life. So, with that being said, there was the Brandon conference, and y'all please subscribe. And anything happens, I'll probably be kicked off various platforms after this, but it's been nice knowing you. So subscribe anyway, and you can remember one day the guy that was a blithering idiot on your computer. So on that, love you guys. Take care, and if I can end this, peace.